there, and welcome to Let's Talk About Health. I'm Dr. Madeline Mant, and today we are speaking to Justin Peddle, who is here to tell us all about the life and times of a pharmacist. So welcome, Justin. Thank you for being here.
Thank you.
So Justin, what is your job? What does a pharmacist do?
Sure. So, we are most responsible for basically optimizing medication therapy. So I am a clinical pharmacist at the Dr. H. Bliss Murphy Cancer Center, and that's located in St. John's, Newfoundland. And we use a team approach there. So I work as part of the medical oncology team, where my role does focus on medication therapy. And particularly at the Cancer Center, I help to optimize medication therapy around treatments for cancer, but also as well as the management of toxicities from those treatments.
Wow. Okay. Now, how did you get into that? Did you go into your medical training thinking I would like to work with cancer drugs specifically, or what kind of was your journey through your education?
Yeah, so the good part about our pharmacy education is that we get to do a number of clinical rotations in different specialty areas.
Okay.
So, of course, we will do rotations in what a lot of folks picture when they picture pharmacy, the standard community pharmacy. But we also do different clinical rotations in community as well as hospital. Oncology was never an area that I got to experience as a student. I worked in a number of other areas such as general medicine, mental health. As a pharmacist, I worked in infectious diseases, critical care, mental health, home infusion, and I really enjoyed different aspects of all of those areas. I had left hospital practice and actually worked in academia for a while. And then upon returning to hospital practice, was looking sort of for the next area that I wanted to try. And I really wanted to try something new. And an opportunity did come up in oncology. To be honest, I was nervous because it is such a specialized area. But now that I'm there and seeing the role that the pharmacist can actually play on the medical oncology team, it's a really exciting place to be working.
Yeah, I'm really interested in you talking about the team approach. In other interviews I've done with various other healthcare professionals, the idea of the teamwork is coming up more and more. Can you speak a little bit more to that, like the role of the pharmacist?
For sure. There's so much literature out there now, and that just continues to grow on the fact that a multidisciplinary approach to healthcare does improve patient outcomes.
Right.
And so rather than having all different professions sort of working on their own and trying to care for the patient in each of their own ways, but separate, we come together as a team. We literally will sit around a table and do rounds on a patient and discuss our experiences with that patient and where we feel treatment should go, for an example. So you will see overlap. So, of course, my main role is regarding the medication therapy, but of course, the physicians play a very important role in the prescribing of that therapy. Nurses play a very important role in the administration and the monitoring of that therapy. So there is some overlap there, but as a pharmacist, that is my number one focus. So looking at the selection of therapy, not just based on the disease itself, but also on the patient, right? The specific patient. So for example, if we use a medication that is cleared through the kidneys, but that patient has an impaired kidney function, we may need to adjust their dose. Right. So patient A may receive a dose that is twice as much as patient B, treating the exact same disease, but each patient is different.
Okay.
So it's sort of looking at medications from that angle. So the selection, dosing, and then after what to monitor for. There are things that we monitor for as soon as we administer a medication, and then there are sort of longer term effects that may be days, weeks, even months out that we know to monitor for.
Well, this is really interesting because I think, and you addressed this a little bit, but I think when people think of a pharmacist, they think of somebody wearing a white coat behind the counter, you might see in a drugstore, et cetera. But it's really interesting to hear about that more long-term kind of diachronic working
Yep.
with patients. And so are there patients that you were checking in with over weeks and months?
Absolutely. So, working at the cancer center, for example, when patients are first seen in clinic, I will very likely see that patient as well and go over their prescribed therapy with them. So, sort of before they even begin the therapy, um, things to prepare for and things to look out for. When they, using chemotherapy as an example, um, after each cycle of their chemotherapy, for the at least for the first couple cycles, sometimes even longer, depending on the regimen, I will follow up with them via telephone. So they might not even be in to the cancer center, but I'll follow up with them at home and talk about different toxicities that they might expect along the way. For complicated regimens that might have longer term effects, our follow up could go on for a very long time with that patient.
Yeah, no, and so I'm hearing a little bit more of that kind of holistic healthcare aspect of things, the team basis and the follow up. And so I want to go into talking a little bit more about use of language. You mentioned disease already, but how do you understand and use words like health and illness and sickness and wellness, pathology, disease, et cetera? How do
Yep,
you use those in your work?
sure. Um, so health is a really interesting one because I don't see health as sort of a binary term. Like I don't think you can say someone is healthy or they're unhealthy.
Right.
So I think it's more on a spectrum, and
Mhm.
it's very interesting because where on that spectrum is the line that separates a healthy person from an unhealthy person, right?
Mhm.
So I mean, I guess to oversimplify it, the more diseases that one has, the less healthy one is. That's one way to look at it. But we further qualify this by looking at factors such as prognosis, life expectancy, whether a disease can be cured or controlled by medications or other treatments,
Right.
and then the impact of the disease on that person's functioning. So when I think about illness as another example,
Mhm.
um, or I would use illness to describe a condition that I guess simply affects a patient's health in a negative way.
Okay.
Maybe this is by producing unwanted or unpleasant symptoms. It may interfere with one's ability to go on about their day as they would normally,
Mhm.
or may, as mentioned before, reduce their life expectancy, or even cause sort of an imminent increase risk of death, or it may do all of those things. And so we yeah, so in looking at illness, we look at, well, what what is the true impact on that patient, and what is their prognosis from that, and what can we do to treat it. um, Again, there's a number of interventions. Sometimes it's surgery. Of course, my focus as a pharmacist is regarding medications.
Mhm.
So what medications can we safely use to either cure a disease, or make somebody more comfortable in a situation where we're not able to cure a disease.
Right. No, that's really interesting, and I really enjoy your look at the spectrum. The idea that do
Mm.
we tip over? What is healthy mean exactly? And it's much
Yeah.
more complex than I think we first realized when we start to go in and try and problematize some of these terms. But your work sounds completely fascinating and sounds really human, which is really kind of exciting. And so I know there might be some students out there that are interested in helping people and might see pharmacy as a way to go ahead and do that. So what advice might you have for somebody that has heard this conversation and is now super gung ho to go into pharmacy?
Sure. Well, I think looking for shadowing opportunities is
Okay.
always a great idea. You never know what opportunities might be out there. So whether you go through your institution or using pharmacy as an example,
Mhm.
even if you went, to a nearby community pharmacy and said that you were a student interested in shadowing a pharmacist, even seeing what opportunities might be out there. Um, Sort of a larger piece of advice that I would give to anyone interested in pharmacy or healthcare in general is to just be very open to all the different opportunities that are out there in healthcare. So in my experience, when folks think about healthcare professionals, the first ones that come to mind would definitely be physicians and nurses, especially if they haven't been exposed to other healthcare professionals throughout their life. But just understanding that um, a physician might be the exact path for you, or nursing might be the path for you, but there are so many other health professions out there as well. So because healthcare has evolved into this much more multidisciplinary approach, um, any and all of these options can result in a very rewarding career in healthcare.
Absolutely. That's great to hear. And we've been speaking with people from a variety of different healthcare professions, as well as people that are interested in health in other ways. And so this has been really, really great to have your voice in your particular area of pharmacy. So thank you so much for giving us your expertise and your time today. And thank you also to the audience for tuning in. So we will see you next time on Let's Talk About Health.